Now, before the WHO made that announcement that the coronavirus is a global emergency, Ontario's two top medical officers of health held a news conference here at Queen's Park. Now, they're downplaying fears that the virus is spreading here in Ontario, but at the same time, they're warning there are still many unknown factors at play.
Right now, we don't have any evidence of this infection spreading in Toronto or in Ontario.
These are Ontario's latest numbers on the coronavirus so far. 67 people with a travel history in the area of Wuhan, China have been tested. 38 tests have come back negative. 27 are currently under investigation but not in hospital. And 2 cases have been confirmed.
Those are small numbers. But in the early days, if it was already picked up, 7, 8, 9, 10 cases in that, I'd be much more concerned. This is reassuring in a way, but not that we're going to sit back and say we can coast.
The 2 confirmed cases are a husband and wife who were in Wuhan, China. He remains in Sunnybrook Hospital in stable condition. She is at home in self-isolation and feeling well. All of the passengers within 2 to 3 meters of the couple on the plane have been contacted by public health and cautioned to look for signs and symptoms, with daily communication continuing.
In all, the system is working. People are receiving and hearing the information about this novel coronavirus and seeking direction from their healthcare providers or the public health unit.
Ontario's Chief Medical Officer of Health says this virus is being handled differently than when SARS hit Toronto 17 years ago. Much of the spread from SARS can be traced to an elderly woman who died at home in Toronto after returning from China. Her son went to the hospital a short time later and waited in a crowded ER for hours, unaware he was passing it on. 81 cases were linked back to him.
You keep stressing that people are more aware and that they're self-reporting and that they're asking questions. Is that the key to combating this?
An informed public is a better public. In an informed healthcare system, it wasn't informed. They didn't know what was going on, but they're much more knowledgeable now. The testing wasn't available. Didn't even know what they're looking for.
The new virus is a grim reminder of the importance of a public healthcare system. Last year, the Ford government was planning retroactive cuts to public health, but softened its position after an intense backlash. Still, the province is now paying less for things like communicable disease surveillance and putting a greater burden on municipalities. This year, for example, Toronto will have to make up a $4 million public health shortfall and $14 million every year after.
Public health is very important in Ontario, always has been, and we intend to make sure it has not been cut. It has not been cut. We are making sure that we have a robust public health system in Ontario, and I'm sorry I need to...
You are reducing the funding, Minister. You are reducing the funding to public health. Now, on Monday, I asked if the provincial cuts to public funding were having an impact on how the coronavirus is being handled here. Toronto's medical officer of health said no.